Knee joint replacement surgery used to be thought of as something meant for elderly people who would be crippled without it. But the baby boomer generation is redefining the who of joint replacement surgery. University of Michigan orthopedic surgeon Dr. J. David Blaha talks about the procedure and offers tips to help boomers prevent the need for such surgery in the future.
In the United States, the number of knee replacement operations is increasing, whereas a few years ago it was commonly said it's about 300 to 350,000. Last year, over 500,000 total knees were done in the United States. Today, especially with the baby boomer population, function is critically important. So I think it is a quality of life issue in that in the older days, we were willing to give older people the joint replacement to keep them from becoming crippled, whereas today, especially the baby boom population, wants to remain functional at whatever cost. The number of orthopedic joint replacement operations at the knee is projected to increase almost exponentially over the next years. The reason for that has to do with the number of people who need the replacement and the fact that the replacements are now, we think, getting good enough to apply them to a younger age group. We expect, if the current usage rates continue, that there could be as many as 3.2 million total knee replacements required 10 years from now. The major reason for joint replacement operations is degenerative arthritis. Degenerative arthritis is a disease in which the cartilage that's on the end of the bones begins to deteriorate and go away. Cartilage is the absolute perfect substance to make a joint out of. It's firm, it's rubbery, it's slippery, and the problem with it is it stops growing when you're 15 years old, and you need to use it for the rest of your life. Right now, we don't know how to put cartilage back on the end of the bones. So if the cartilage begins to degenerate from the end of the bones, that becomes a chronic and incurable disease. And as bone gets closer and closer together, especially when you get bone-on-bone contact in the knee, the pain and the decrease in function because of that pain can be very severe.
In the first few years, the pain really was not that bad. As you got older, and they warned me that arthritis would set in. And, every few years I'd go see the orthopedic surgeon, and they would take a look and say, yeah, you're developing arthritis, and in fact, you are getting more pain.
In this model, the cartilage is colored blue. You can see that all the way over the end of the thigh bone and the top of the shin bone, there is this articular cartilage, which is the perfect stuff to make a joint out of. When the joints are affected with degenerative arthritis, you can see that the cartilage has gone away from the end of the bone so that the bone is exposed. And when the bone rubs against the bone, that causes significant pain and loss of function because of the pain. In the knee replacement operation, we carefully remove the end of the bone that contains the cartilage so that the bare cancellous bone is exposed. And following that, we place a joint replacement which has a piece of metal that goes on the end of the thigh bone, generally a piece of metal that goes on the top of the shin bone, and then a piece of plastic in between, so that the metal rubs against the plastic, and now, instead of bone rubbing against bone causing pain, metal rubbing against plastic doesn't cause pain. And then generally put a piece of plastic on the back of the kneecap as well, and that then replaces the entire knee joint, a total knee joint operation.
The very next day when I really came around from the surgery, even though it's a very invasive surgery, I felt terrific. And I realized later that the whole reason was I was on medications that were relieving most of my discomfort, but I just had not been out of pain for so long, I forgot what it felt like to not be in pain. And I was on top of the world. Since I've had the knee replacement, I can live the life that I want to live. I don't find myself negotiating around with the things that I need to do, with the things that I want to do. I can do everything that I really want to do.
Prevention of knee arthritis is extremely important, especially in view of the fact that it looks like there's going to be far more knee replacements necessary than there are orthopedic surgeons to perform those operations. We do know that obese people have a higher incidence of degenerative arthritis, and people who've had serious knee injuries have a higher incidence of arthritis. Therefore, keeping yourself at a reasonable body weight, staying fit, and not becoming obese definitely will decrease the rate of osteoarthritis and should decrease the rate of knee replacement necessary.